Okay, sorry. We're good? Hey, how's it going? We're good. All right. This is Dr. P. I'm here with Bill today, and he's about 9 months out from an ACL revision surgery, reconstruction revision surgery. And then a couple weeks after that, we also added some bone marrow aspirate cells and some PRP, platelet-rich plasma. And when was your first ACL tear?
I believe it was 2012.
So we did a reconstruction and he did well, but then unfortunately he tore it again. And what we found is certainly the regenerative medicine helps with lots of different things, okay? But especially on revision surgeries, even primary surgery, but especially on revision surgeries, because if you're doing a surgery for a second or a third time, unfortunately that happens, especially with a lot of the athletes we deal with, pitchers, they're throwing, they tear it, you fix it, they go back to throwing, they tear it, that type of stuff. So revision surgery is anytime we're doing another surgery, like second, third, fourth surgery. And so anytime you do a revision surgery, the healing rate is less, the recovery rate is longer, the failure rate is higher. So we want to do everything we can do to optimize it. And what we found is that even in primary surgeries, if we add the added biologic boost of like the bone marrow cells, the PRP, laser, I think you did laser, those type of things, that our results are subjectively better. Now, objectively, he's part of the data biologics registry. We were just talking about this. And so we are tracking his results, but he is doing outstanding. His range of motion is much better than it was prior to the surgery. His knee's completely stable. He's back to full duty work. What are your thoughts on how this went compared to the prior ACL reconstruction?
It went a lot better. I mean, I'm pretty much can do whatever I want when I want. There's no glitches, no nothing.
Do you think the recovery, and again, you can say one way or the other, but was the recovery a little easier this time, or was it harder because you're a little older now, or what was your thoughts?
It's probably a little harder because there's way more done. I mean, the list is huge what got done in there, which the first one wasn't.
That's true. We did have a lot more things to do, not just reconstruction. You're right. We injected the bone. We had meniscus problems. We had cartilage, more arthritis this time. That's true.
Yeah. But other than that, I mean, it went good. I went back to work, it was 6 months ago. Actually, on light duty, and then today I got full. So that's good.
Well, you did it. It's a lot of hard work no matter what. The revision's always going to be harder. But subjectively and even objectively, our findings, we're finding that we think that adds. And so stay tuned, because we're doing the research on it and we're putting the results in the registries, and we'll know at some point. But so far so good. Great job.
Very good. Thank you.